Japan decided to adopt the German social health insurance model in the early 1900s. This is because when Japan decided to implement a model, they learned about other systems being used at that time and chose the Bismarck system because they thought it was the best. Japan requires all citizens to buy insurance through their companies, and then the country provides health insurance to low-income individuals through a public social assistance program. This allows Japan to provide 100% coverage for all of its citizens.
Now I will be talking about the primary health issues in Japan. Before I do, just a general information about Japan and where they stand right now. Japan is currently aging and they are below fertility rate. As of 2019, they have 128 million people with a birth rate of 1.4, which is below replacement. Most of the population, as I say, is aging, so most of the disease that Japan is struggling with is regarding to old age. As you can see, based on the chart that I place here, Alzheimer's kill about 50% of the population between 2000 and 2019, followed by COPD, pancreatic cancer, and chronic kidney disease, and colorectal cancer. Those are the major killers, health issues that's happening in Japan at the moment. And the government is taking steps to address it. They are trying to find a way to get younger, but it's very difficult as people decided not to be having children or reproduction. Next, I will be talking about the pest analysis for Japan. As you know, P is for political. Political in Japan, the country's head of state is the monarch. Like many monarchs, they're not really, they have very limited power, but they are more there for a symbol, as a sign of symbol. Next, we're talking about the economic. As we all know, Japan is very robust economically. Japan is the third largest economy in the world with a GDP of 4.9 trillion. However, according to the World Bank, the economy will grow 1.3%. And due to Japan's declining population, they will face economic challenge, but that's why you see Japan's companies are always focused on overseas sale. The social environment in Japan, it's the 10th most populated country with about 128 million people and aging population. So Japan have a big crisis in terms of aging diseases. And for technological factors, we all know that Japan is one of the most technologically advanced countries in the world. Japan is addressing their age problem with robots to do babysitting of the elders at home and various other technologies to help with the current healthcare problem. Next, I will pass it on to my teammate.
This is Omar Abarca, and we will be covering the Japanese health system structure on the next 3 slides. The Japanese administration healthcare system comprises of 3 levels: the top national level central government, the prefectural level, and the municipal level. The Ministry of Health, Labor, and Welfare is the center of the system, and it establishes the principles and basic laws. The national health policy is implemented through local governments in a top-down approach as depicted on the diagram. The prefectural level, which is in the middle, is kind of more regional oriented, so it coordinates activities among the municipalities. Most basic health and welfare services, such as those for mother and child and the elderly, are provided by municipal governments. I would like to direct your attention to the labels EHI, also known as SHI, at the top level of the diagram, NHI at the prefectural level, and LTCI at the municipal level. We will learn more details about these entities on the next slide. There are over 3,000 health insurance funds, and they are divided between 3 insurance types. The first type is the employer-based health insurance, which is also known as social health insurance. The SHI targets employees of large corporations, and they both contribute equally 5% of the salary. The second type is the residence-based national health insurance. The NHI is basically for everyone else: students, freelancers, people who work in small companies, and a lot of foreigners who find themselves signing up for these in early stages of their visit. The last one is the health insurance for persons over 75, which is the long-term care insurance. Each of these schemes contributes to a common fund, and this is the single fund that is used to support all the expenditures in healthcare in Japan. The coverage in Japan is mandatory for anyone who permanently resides in the country for 3 months or more. This includes both Japanese citizens and non-Japanese citizens. Consumers have no choice of health insurance programs. Plans are designated according to the consumer employment status, age, and residence. The premium may vary, but is not significantly. On the other hand, there are no restrictions on access. Regardless of the plan, policyholders can receive care from any medical provider as frequently as they would like. The government of Japan uses a nationally uniform fee schedule for reimbursement when patients see a doctor. That means you know what a service will cost, no matter where you happen to be in the country, so there are no geographic changes in cost that can surprise you at the end. Because you are paying taxes into the healthcare system in Japan, you're only receiving a benefit from this effort if you need to visit a doctor for some reason. If you're a generally healthy person and don't need to see someone very often, then you're essentially subsidizing the cost of those who need more medical services than you do. Although there are some significant successes to consider with the Japanese healthcare system, the government is currently prioritizing the resolution of some of the top issues. One of them is the difficulty to monitor the overutilization of inpatient stays. Apparently, it is cheaper to spend an extra night in the hospital than choosing a local low-price hotel. Japan is also looking to launch initiatives for doctors working long hours in the public sector with low salaries. The government is also prioritizing global health initiatives to better respond to public crises like the current pandemic. In addition, Japan is improving the current programs for research since it's falling significantly behind in this area compared to other developed countries.
The Japanese health system is mandatory for all citizens and residents. It has a public and private health system. Under public system, the employment-based plan covers 58.5% of the total population, the non-employed-based plan covers 27%, the elderly plan covers 12.7%, and public social assistance program covers 1.7%. All the public health system covers same benefits determined by the government and covers hospital visits, specialty and primary care visits, psychiatric care, approved prescription drugs, physical therapy, and dental care. The private insurance, on the other hand, acts as a supplement, and more than 70% of the Japanese population has private insurance to cover severe long-term sickness, hospitalization, and special treatment like orthodontics. The public insurance does not cover optometry, chiropractic, and alternative medicines. The expenses of public health system in 2019 was 40.5% for inpatient treatment, 34.1% for outpatient treatment, and 17.8% for dispensing medicines.
This is Danny Moen with an overview of Japan's health system performance with regard to cost. Performance based on key metrics suggests Japan's health spending is not excessive when compared to other nations we've studied, especially when compared to the United States. However, their rate of growth for medical expenditures significantly outpaces the US and the OECD average, and because of this, they employ a range of robust cost containment measures. While Japan requires a 30% out-of-pocket coinsurance payment for all health services and drugs, this isn't enough to discourage overutilization. Japan sets a strict fee schedule for all health services, drugs, and devices. Any deviations from the pricing structure are strictly prohibited, and often prices for the most profitable categories are reduced the most during biennial review process. Additionally, there's a national cost containment plan for healthcare, which is revised every 5 years and focuses on areas like care coordination, home care, the promotion of healthy behaviors, and health expenditure targets for individual prefectures. Finally, there are financial incentives provided to physicians to improve clinical decision-making and prevent the overuse of services.
Japan's government sets the rate for medical procedures. Their prefectures also set the medical plans for different diseases, such as cancer, heart attack, and stroke. Japan has twice as many hospital beds as the United States. In addition, the average hospital stay in Japan is 36 nights compared to the United States, which is only 6 nights. Nancy Doubts, the former head of the ICU at Penn, suggested that Japan's hospital beds tend to not be as technologically advanced as American hospital beds. Therefore, people are probably not as sick when admitted. Due to the Shinto religion, the Japanese also avoid going under the knife and lean towards more preventative and holistic medicine compared to Western countries. While their life expectancy, infant mortality, and obesity rates are good, they could reduce their surprisingly high rate of smokers. As a whole, Japan's quality is well suited to their needs and values.
Japanese healthcare is universal and access is good. There are over 179,000 medical care institutions across Japan and all accept any kind of insurance, with greater concentrations of facilities and healthcare professionals in urban areas. Excellent transportation infrastructure supports prompt emergency response. Japan has higher than average numbers of hospital beds and utilization, but lower than average population density of healthcare professionals. Of note, only 20% of physicians are women, which can limit access for patients who prefer a female provider. Employers are required to have an occupational doctor on staff and more if they employ more than 3,000 people. Safety nets are in place, including annual household health care and long-term care caps and monthly catastrophic care caps based on income and age. Subsidies and lower coinsurance rates are available for low-income populations as well as children under 6, those with chronic conditions, disabilities, and mental illness. Primary care needs are met regionally as each prefecture manages their own care delivery networks. Primary care practices are privately owned and readily available to all with short wait times and optional house calls. Physicians don't act as gatekeepers in this system, but there can be an extra charges as a consequence for self-referrals to large hospitals. Japan enjoys nearly equitable access for all citizens with no financial barriers. However, some studies suggest small gaps may be growing in some prefectures, possibly due to variations in material deprivations, smoking and drinking behaviors, and occupational hazards. While Japan provides universal access for their citizens, over 2.5 million foreign residents face barriers to care, including lack of translation services, reportedly higher fees, and potential denial of care due to lack of insurance. As this population grows, Japan will have to do more to address these barriers. Japan is working to reduce inequity among their citizenry, however, supporting remote areas with subsidies for healthcare facilities and student loan forgiveness programs for healthcare workers who support certain areas. A national health promotion strategy was developed in 2012 to address health discrepancies between prefectures, encouraging local government efforts to coordinate and improve.
So some of the notable innovations for Japan are that everyone is covered by the public health insurance program, and people are free to choose whatever healthcare facility they want, and they have free access to those facilities. They provide a high quality of care and the cost is efficient. There is no need to make appointments because visits are typically short. Japan has the highest expectancy rate with the lowest infant mortality rate, and insurance is given to employees and their family members. National health insurance covers self-employed and unemployed citizens and provides additional help to those with disabilities such as victims of pollution that suffer from asthma and those with intractable diseases. They also developed elderly late care system that is dedicated to 70 or older population. They have excellent medical devices for minimally invasive treatments using laser tech and ultrasound, robotic surgery, implantable devices, custom-made artificial joints and bones through the use of 3D printing tech, devices that are suitable for disaster relief such as portable X-ray equipment. There's a significant focus on telemedicine, home care, and solutions that enable the early detection of diseases such as cancer. And everyone is required to have an annual health checkup. They also developed initiative on rare and undiagnosed diseases to reach out to those people suffering from unidentified diseases. So it's a clinically research program for a disease of unknown etiology, which requires currently unavailable treatment measures and long-term care for the patient.
Hello, this is Eric Lanz going to be telling you about some improvement opportunities within Japan. So first, how are costs contained? The 30% coinsurance in the SHIS does not appear to work well for containing costs. By contrast, price regulation for all services and prescribed drugs seems like a critical cost containment mechanism. The fee schedule is revised every other year by the national government, and this revision involves 3 levels of decision making: the overall rate of increase or decrease in prices of all benefits covered by SHIH, revised prices for drugs and devices, and prices of individual services. The National Cost Containment Plan for Healthcare is intended to control costs by promoting healthy behaviors, shortening hospital stays through care coordination and home care development, and promoting the efficient use of pharmaceuticals. Okay, so what about quality? By law, prefectures are responsible for making healthcare delivery visions, which include detailed service plans for treating cancer, stroke, myocardial infarction, diabetes, and psychiatric disease. These delivery visions also include plans for developing pediatric care, home care, emergency care, prenatal care, rural care, and disaster medicine. In regards to access, the electronic health record networks have been deployed only as experiments in selected areas, but has not generally been established. The national government prioritizes care coordination and develops financial incentives to encourage providers to coordinate care across care settings, particularly in cancer, stroke, cardiac care, and palliative care. The government also provides subsidies to leading providers in the community to facilitate care coordination. Highly specialized, large-scale hospitals with 500 beds or more have an obligation to promote care coordination among providers in the community. Meanwhile, they are obligated to charge additional fees to patients who have no referral for outpatient consultations. There are more than 4,000 community comprehensive care support centers that coordinate services, particularly for those with long-term conditions. To reduce disparities, which has been a goal of Japan's national health promotion strategy since 2012, has set 2 primary objectives: reduction of disparities in healthy life expectancies between prefectures, and increasing the number of local governments organizing activities to reduce these healthcare disparities. Innovations and reforms. So in 2018, the Social Security Council set 4 objectives: to develop efficient and comprehensive care in the community, to develop safe, reliable, high-quality care and create services tailored to emerging needs, to reduce the workload of healthcare workers, and making the healthcare system more efficient and sustainable overall. And to proceed with these objectives, the government modified numerous incentives in the fee schedule. In addition to the continuous care fees, hospital payments are now more differentiated according to the hospital's staff density than those of the previous schedule.